This is John Geaver for MedPage Today. One of the most rural states in America is West Virginia. It has some of the nation's highest rates of infant mortality, obesity, diabetes, and other measures of poor health. It's probably not a coincidence that much of it also suffers shortages of physicians and other health professionals. But the state has developed a series of programs operated mainly out of its health campuses in Morgantown, Huntington, and Lewisburg that are successfully placing young health professionals in rural communities.
We've discovered that well more than half of people who train in a particular residency location will stay within a 50-mile radius. So where you train and what you do and what specialty you choose has a major impact on how many people are likely to practice in a rural area.
The program begins in students' third year of med school and carries through their residency. It includes a guaranteed residency spot in one of the 3 WVU health campuses in West Virginia, as well as a $10,000 stipend paid in their 4th year of med school. The designated rural scholars receive extra training in primary care medicine and in the leadership skills a primary care doctor needs to be effective in rural communities. Beginning in their 4th year of med school, participants design and implement a community intervention project in some rural community in West Virginia.
One young man who is now a 2nd-year resident who had a particular interest in screening high school students for a very common sexually transmitted disease called chlamydia. And being a very sensitive subject, that carried a lot of emotion in the community, but he went back to his small town where he hopes to practice. He worked very diligently in building alliances with the school system, the Board of Education, the school nurse, the public health department, and the state health department. He was able to configure all these pieces together. And then, at the last moment when it looked like his screening program could be in place, there were some concerns from the lawyer who represents the school board. And so he went to a school board meeting and testified for 90 minutes on the value of this program and was able to convince that community that this would be a worthwhile thing to do to improve health outcomes among teenagers. And just that process, even though the program is just beginning, just that process allowed this doctor to become better linked to his community, understand the cultural, social, economic, and educational factors that contribute to health in the community, and allowed him to develop some incredible leadership skills that he never would have had the opportunity to develop. And so this is kind of a small kind of summary of the power of the projects that are in place around communities in the state.
And the state has another program benefiting physicians going into practice in areas designated as underserved. Using mainly federal dollars, the state will pay off a big chunk of the debt that most physicians acquire during their schooling. Dr. David Hess practices in the small Ohio river town of Glendale, along with his wife, a pediatrician. He's a native West Virginian and went through medical school at WVU.
I would say for me it was probably about $10,000 to $15,000, which is a huge chunk. I mean, obviously. And basically, if you stayed here, every year you stayed here, $5,000 was forgiven of that particular loan. Now, obviously, that wasn't all our debt, but a portion of it certainly was forgiven as we came back. The other way that we've benefited monetarily is we also applied for a grant after we came out in private practice. And also, through the hospital would match the state's funds. And the hospital, I can say that $60,000 between my wife and myself had been, well, actually that would be $60,000 apiece of our loans were forgiven for the first 3 years that we practiced in this area.
Of course, other states also offer loan repayments to encourage physicians to locate in needed areas. In West Virginia, these enticements don't appear to be a critical factor. Dr. Hess and his wife decided to locate in Glendale at a point several years ago when some doctors were shutting their practices because of skyrocketing malpractice insurance premiums.
The most important thing, when we have medical students that rotate with us, and even residents out of medical school, we make sure that we tell them the most important thing is where you're going to be happy. And everything else will kind of come into play, or it will kind of work itself out. And that's ultimately why we made the decision to come into a medical malpractice crisis, so to speak, as we knew the rest of our lives would be, pretty happy. Our families here, we would have babysitters when we ended up starting a family. So the rest of our lives was in such harmony and peace that really the medical malpractice was a small portion of it.
I did actually, yes. I grew up in a very rural area and always enjoyed working with that kind of people, and thought that's where I'd want to be. If there was one thing I could tell people that were thinking about this, I would say it is worth it just for the gratification of helping people, and especially these people.
That program can eliminate as much as 80% of whatever debt they may have if they go into an area. But they have to be practicing in a community that is a designated high service need community. And sometimes that's something that not everybody understands. But if they are in a needed specialty, in a needed community, they can be eligible for the state loan repayment program.
Most of the students for whom rural medicine is appealing are themselves from rural areas. The programs in West Virginia are less about recruitment in the sense of bringing young health professionals into West Virginia than it is about retention, about keeping the native sons and daughters home.
As you meet people and meet people that you want to spend the rest of your life with, start a family, you realize that family is probably the most important thing. So you realize that you miss some of the people that were here that you knew. There's no friends like your young friends and your friends that you grew up with. So it's hard to replace those friends as you get older. It's difficult to meet somebody as you're older and say, that you're truly as close to them as you were with people when you were younger. So we wanted to come back closer to friends, family, but it wasn't a very popular decision. And certainly initially, I had thought that I was gonna get an education and get out of the state, as a lot of my friends ended up doing.
I don't think so. I'm a country girl. I've never really wanted to go to the big city. Morgantown, here is just a little bit too big for me, so I certainly would never want to go anyplace bigger.
We established our own benchmark starting way back in 1992, and we had, I think, roughly about 80 graduates who were started in the program, and then by 96 would have been graduates and eligible to go into practice. And so starting back in those early years, we had 88 and all the way up to 264. And so looking at that rate of increase, we've actually increased the number of physicians that are in rural communities by 200% in just under 9 years.
Of course, keeping health professionals in rural communities is only part of the health equation. West Virginia continues to be among the nation's worst states in terms of life expectancy, infant mortality, obesity, diabetes, and other measures of health status. And many parts of the state remain underserved, especially with regard to certain professionals.
The other thing that we're beginning to experience is that we know that, nationwide, mental health providers in rural areas has been a huge gap for a long time. And one of the things that we know is going to start happening in not only West Virginia but other predominantly rural states is that our returning soldiers and their families and the increased need for mental health services within rural communities, simply because of the surge of returning soldiers, is really going to start impacting that, and I hope will bring light nationally to the fact that we already don't have enough services in rural communities, and that these folks certainly deserve the best that we can provide them, as do everyone.
But West Virginia's rural medicine efforts at least offer hope that if the exodus of health professionals can be stemmed, its other health problems may not be intractable either. In West Virginia, I'm John Geaver, MedPage Today.